Procedures that medical students need to know. Procedures or operations that medical students need to know. A medical degree is a great degree to have. It includes a lot of theoretical information. We all know that. At least study of 10,000 hours by the time you do 2 degrees, undergraduate and a postgraduate degree. There's a lot of learning. But it's incredibly practical. It has to be. Medicine is a practical thing. So there's a lot of procedures you need to learn. And these are real procedures you have to be able to perform when you get your registration. It's no use being a psychiatrist on a ski slope later on and someone has a heart attack and you say, oh, I'm a psychiatrist, I can't do CPR. Or I'm a neurosurgeon, I no longer know how to treat a fracture. It just doesn't work like that. People in the community expect you to be able to do these procedures. So best to get in there and learn them. The most enthusiastic medical students go and seek out these procedures to learn them, even though that may not be part of the formal program, which it should be actually. So the best time, as we all know, is in the evenings or weekends when all the form fillers and the people who carry these wretched things are away, and the ED is busy, the hospital is busy, so you can make yourself available to do it. Here they are, so see if you can get in there and learn these procedures. It will really help you a lot. So pretty much we can start at the top of the body. You need to be able to secure the airway and ventilate the patient. Next one is intubate, put an endotracheal tube in. It's quite hard to do, but someone can teach you how to do it. Then you have to put an IV line in. That's pretty important, isn't it? For fluids, hemorrhage, shock. Next one, take a blood gas, that's important. Put in a urinary catheter for a male can be quite hard actually. For a female can be almost impossible. You need to get the nursing staff who are good at putting catheters in for females to teach you. And then of course the above, all about doing CPR. You really need to do CPR. In my opinion, you need to be able to deliver a baby, a vaginal delivery. See if you can get that. Next one's put on a plaster. It's very important, how to properly put on a plaster. It's not as easy as you might think. Next one is reduce shoulder dislocation. Hang around the ED. These commonly occur in the community and a ski slope on holiday. You might be required to assist. Put in a chest tube, pneumothorax. It's not as hard as you think. Put in a nasogastric tube, that's when patients are vomiting. Put it in through the nose. Good. Obviously you need to do skin sutures. Suturing lacerations, you do that down the ED. Next one, drain an abscess, skin abscess. That's pretty easy to do, but you need to learn how to do it. Put in an intra-arterial line, that's usually done for blood pressure monitoring. It can be a lot more difficult than you think. Do a lumbar puncture patients suspected of having meningitis, and be a surgical assistant. Go into the operating room whenever you can, usually after hours, weekends, and make yourself available. Now I'm leaving this list on the screen. You could print out this list and just tick them off as you get to do these procedures, say over your last 1 or 2 years at med school. Once you got those under your belt, you can be confident. You can manage a lot of these things rather than waiting until you become an intern. And believe me, you can't get away without doing most, if not all, of these procedures. You really need to learn how to do them. Anyway, good luck with your career. I'm sure you'll learn doing these procedures as most students do.